This week, we learned about a new strain of the COVID virus that spread to Indiana and 8 other states. That new variant is spreading faster than anything we've seen in the past 10 months. Brooke is going to explain now what that means for us.
It's the strain responsible for England's latest lockdown, a mutation of COVID-19, which isn't unusual for viruses. But there is cause for concern with this one.
It appears to be more infectious. It's probably about 70% more infectious.
It's called the B.1.17 variant. Floyd County's health officer, Dr. Tom Harris, says instead of infecting 2 to 3 people with COVID, a person with this strain could infect 5 or more.
There's no evidence that the new strain is more lethal. There's no evidence that the new strain, is more persistent or lasts longer.
But the fact that this strain is more contagious is problematic. The more people infected, the more chances of dying from a virus the majority of us still are not protected against. The good news, it's believed the Pfizer and Moderna vaccine will protect you from both strains currently in the U.S.
Which brings us to the issue of the week, which is we need the vaccine. If you look out the window, we're doing vaccines even as we speak. We have a capability of doing over 500 people a day, but my vaccine allotment for this week was 600.
Indiana began vaccinating people 80 and older on Monday, opening up registration for its 70 and over crowds Wednesday. Kentucky has yet to vaccinate the general public as both states wait for more shipments.
There's a school of thought now that maybe we should just give one vaccine. We're waiting on guidance from state and federal agencies. But it's a numbers game. So say you have 50 million doses. You can vaccinate 25 million people up to 95%, or you can vaccinate 50 million people up to 80 to 85%.
Whether it's decided more of us get the shot with or without the booster, Dr. Harris has this to say.
The vaccine does not make you invincible. Even if you have the best antibody response you can have, it's about 95% protective, which sounds great till you realize that 1 out of 20 people that get the vaccine could still get the disease.
So mask up and keep your distance, even after you get the vaccine. In Floyd County, Brooke Hash, WHAS 11 News.